Veterinary internal medicine. Breed-associated biochemical abnormalities in dogs. The following presentation is based on the writings of Dr. Julie Allen. The serum chemistry profile is a primary component of the minimum database. However, test results should always be interpreted in relation to other patient findings including signalment, history, and physical examination. Of particular importance is the patient's breed, which should always be considered when interpreting results. Because breed-specific reference intervals are not established for every breed, it is important to be aware of parameters that may lie outside reference intervals but may be frequently encountered without obvious pathology in a particular breed. Conversely, it is also imperative to know when an abnormal laboratory result is of concern for a certain breed due to associated disease predisposition. Following are Dr. Julie Allen top 5 breed-specific biochemical abnormalities that we can find in dogs. Some studies have documented persistent, progressive increases in alkaline phosphatase levels in Scottish Terriers resulting from increased synthesis and release from biliary epithelium, hepatocytes, or bone. Induction can be stimulated by cholestasis, corticosteroids, hormones, and increased osteoplastic activity. The corticosteroid-induced isoform is the most often increased in this breed. Increased alkaline phosphatase levels typically occurs in the absence of notable clinical signs, although some clinicians have suggested that some neutered male dogs develop prostate enlargement and some Scottish Terriers may develop polyuria and polydipsia. However, few of these dogs test positive for hyperadrenocorticism on routine screening tests, like for example the low-dose dexamethasone suppression test, whereas others have increased levels of sex steroid hormones, predominantly progesterone and androstenedione. In a study of dogs that tested positive for hyperadrenocorticism and were treated with trilostane, treatment was ineffective in all dogs and detrimental in some cases, possibly due to the increases in sex steroid hormones. Of note, clinically normal dogs should not be tested for hyperadrenocorticism, a genetic defect similar to the 21-hydroxylase deficiency that causes adrenal hyperplasia in humans is suspected to be the cause of increased alkaline phosphatase levels in Scottish Terriers. The disorder causes no clinical abnormalities in some dogs, whereas others gradually develop a degenerative vacuolar hepatopathy that occasionally progresses to hepatic insufficiency, sometimes with secondary portal hypertension. Increased hepatic copper levels may also occur, and some dogs develop hepatocellular carcinoma. As a result, increased alkaline phosphatase in Scottish Terriers should not be dismissed as inconsequential and warrants additional diagnostics, like for example abdominal ultrasonography and bile acids test. Yorkshire Terriers anecdotally have a higher incidence of increased blood urea nitrogen as compared with other breeds. However, this abnormality is often associated with normal creatinine levels and adequately concentrated urine, suggesting a prerenal cause. Differential diagnoses for prerenal causes of increased blood urea nitrogen in dogs include dehydration, gastrointestinal bleeding, consumption of a high-protein diet, and increased protein catabolism due to strenuous exercise or the use of corticosteroids, but in a large percentage of Yorkshire Terriers, these causes are excluded. Yorkshire Terriers are predisposed to gastrointestinal disease, including protein-losing enteropathies. Thus, it has been postulated that the increased blood urea nitrogen levels may result from subclinical gastrointestinal bleeding, although these patients do not appear to develop signs of iron deficiency anemia and anecdotally have no response to gastrointestinal protectant therapy. In addition, a recent study in Yorkshire Terriers with protein-losing enteropathy identified low blood urea nitrogen levels among the clinical pathology findings. To further confound this issue, this breed has an increased incidence of congenital liver disease and corresponding decreased blood urea nitrogen synthesis. A renal origin cannot be completely excluded, however, as some Yorkshire Terriers have concurrent proteinuria and, in one study, this breed accounted for 5 to 8% of biopsy-confirmed cases of immune-mediated glomerulonephritis, perhaps supporting glomerulotubular imbalance as the reason for increased blood urea nitrogen. At this moment, a cause for the increase of BUN remains unclear and more research is needed. In the interim, high-protein diets, gastrointestinal bleeding, and renal dysfunction should be eliminated as potential causes of increased blood urea nitrogen. Anecdotally, This biochemical abnormality does not appear to have much impact clinically in Yorkshire Terriers. Greyhounds are considered an idiosyncratic breed due to several clinical pathology variables that often fall outside standard reference intervals. One of the best described is increased creatinine levels. Creatine is synthesized in the liver from glycine and arginine, after which it is transported to skeletal and cardiac muscle, and phosphorylated to phosphocreatine in a reaction catalyzed by creatine kinase. Phosphocreatine then acts as the major energy store for muscle by donating phosphate during episodes of decreased adenosine triphosphate ATP. The residual creatinine is the degraded to creatinine, which is excreted essentially unchanged from the kidneys. Various causes have been proposed for the increased creatinine levels in greyhounds, including decreased glomerular filtration rates, although this was not substantiated. Eating a high-meat diet which is usually fed to racing dogs has also been suggested as a factor. However, in one study, elevations persisted after dogs were retired and fed a more conventional diet. The increase has also been anecdotally attributed to higher body stores of phosphocreatine as a result of increased muscle mass, which could also account for the higher ALT levels seen in this breed. Consequently, mild increases in creatinine levels up to 2.1 mg per deciliter in clinically normal greyhounds may not require further diagnostic investigation. Mean SDMA levels is also higher in greyhounds than in other dogs and has a difference reference interval. However, this biomarker is believed to be unaffected by lean muscle mass, so further research into the exact cause of increased creatinine in this breed is warranted.
Labrador Retrievers are predisposed to chronic hepatitis due to excessive copper accumulation. Idiopathic chronic hepatitis has also been noticed. Labrador with this disorder may be subclinical or have signs that range from mild to non-specific to indicators of severe liver disease, such as jaundice or ascites. The copper-associated form of the disease appears to have both a genetic and dietary causes. For example, an ATP7A and ATP7B gene mutation can be the cause of this condition. But also the use of commercial dog food can be another cause of this problem. Liver biopsy with histopathology is required for definitive diagnosis and monitoring of the condition. Mononuclear or mixed inflammatory infiltrates with hepatocyte necrosis and/or apoptosis and varying degrees of fibrosis are found on biopsy. Histochemical staining and quantification of hepatic copper levels are also essential. ALT is a moderately specific indicator of hepatocellular damage injury in dogs, and an increase in ALT levels is the most common clinicopathologic abnormality noted in Labrador Retrievers with chronic hepatitis. Although ALT measurement is an acceptable predictor of histopathologic evidence of chronic hepatitis, its sensitivity is poor in the early stages of the disease. As a result, it has been suggested that a different reference interval with a lower upper limit be considered for this at-risk breed. Circulating microRNA, and testing for ATP7A and ATP7B gene mutations for diagnosis and, in the case of microRNA, monitoring the disease may also be valuable. Increased ALT in other breeds of dogs should not be overlooked. Persistent ALT increases should be evaluated further with bile acids and abdominal ultrasonography, although hepatic biopsy with histopathology and Cooper quantifications is ultimately required for definitive diagnosis. Hyperliposemia has been described in boxers. Lipase has several sources but is usually of pancreatic origin. Some assays are considered to be more specific for the pancreatic isoenzyme than others. In general, lipase can be increased with pancreatitis. Gastrointestinal disease. Exogenous steroids. Decreased glomerular filtration rate. Lipase is renally excreted, and rarely. Hepatic or pancreatic neoplasia. Boxers with increased lipase levels are often clinically normal and have no gastrointestinal signs or other manifestations consistent with pancreatitis. No laboratory abnormalities can be noticed besides an increase in lipase levels. This has led to speculation that boxers may have higher values as a normal finding and may warrant a breed-specific reference interval. However, in a postmortem study, pancreatitis was reported with a higher incidence in boxers than in other breeds, although only 2 of the 200 cadavers examined were boxers. The breed disposition for this disorder was suggested again in a study in which 4 of 61 dogs with chronic pancreatitis were boxers. If boxers are predisposed to pancreatitis, it seems to be subclinical in most cases. As increased prevalence of chronic pancreatitis may eventually result in exocrine pancreatic insufficiency, however, another study found that boxers are in fact at lower risk for pancreatic insufficiency than other breeds. Boxers are at extremely low risk for diabetes mellitus but at higher risk for insulinomas. The genetic reasons for the findings remain unknown, but an abstract several years ago noted that islet cells in boxers were larger than those in other breeds, suggesting higher beta cell mass due to increased islet regeneration and/or reduced apoptosis. The larger islet cells could explain this breed's resistance to diabetes mellitus and predisposition to insulinoma. Perhaps the exocrine pancreas in boxers also has a greater mass compared with other breeds, which may account for the hyperliposemia. More research is needed into the pancreas of this breed, but it is possible that increased lipase levels may be less of a concern in boxers than in other breeds, particularly in the absence of clinical signs. It is important to recognize that these serum abnormalities in specific breeds of dogs may represent underlying pathologic or, in some cases, subclinical disease processes, versus an expected or normal finding. These biochemical abnormalities also provide another rationale for serial monitoring of laboratory test results to assess persistence and/or progression.
In this presentation we discuss the 5 breed-associated biochemical abnormalities in dogs. This video covered the following serum abnormalities in the canine population. Increased ALP in Scottish Terriers. Increased BUN in Yorkshire Terriers. Increased creatinine in Greyhounds. Increased ALT in Labrador Retrievers. Increased lipase in boxers. It is of the utmost importance to consider the patient's breed when interpreting blood work results. Increased ALP in Scottish Terriers should not be dismissed as inconsequential and warrants continued monitoring and additional diagnostics as needed. An increase in ALT levels is the most common clinicopathologic abnormality noted clinically in Labrador Retrievers with chronic hepatitis. Increased lipase levels may be less of a concern in boxers than in other breeds, particularly in the absence of clinical signs. The pathogenesis for increased creatinine in Greyhounds is not completely understood and warrants more research. In Yorkshire Terriers, an increase in BUN with normal creatinine and not clinical symptoms of renal disease is considered inconsequential for this breed. This presentation belongs to the category of veterinary internal medicine and the subcategory of veterinary clinical pathology. Veterinary clinical pathology. Breed-associated serum abnormalities in dogs. Veterinary channel. Veterinary internal medicine. Breed-associated biochemical abnormalities in dogs.